To our weekly update of the COVID-19 situation that we're dealing with here in Davie County. We are trying every week to create a platform to allow all of you to get essential information that you need, and also create a process where you can get information to us or questions you may have, and we will talk about that at the very end of our time today. But today we have a great lineup for you here in Davie County to be able to tell you what you need to know. And today's speakers, as you can see here, is your county management, which I will start off there as John Eller, your county manager. We also have our Health and Human Services Director, Suzanne Wright, our Sheriff, J.D. Hartman, Brian Bird, our Emergency Services Director, our 911 Communications Director, Rodney Pierce, our Public Utilities Director, Johnny Lambert, and Jeff Wallace, who's our Superintendent of Davie County Schools. Everyone will be taking turns today to give you critical updates that we think you might need to know, and we'll continue to refine this one time every week as we do these to be able to get information out to our citizens that we feel is important for you to know. Every week we may invite a different guest to join our conversation to get information out. There may be a different topic or different theme, and so we will take care of that as we continue to do these updates. And then also we want to let you know that all the departments that you're talking to are doing a lot of contingency planning right now and really planning as things go forward to continue to provide the best services we can to our citizens during this crisis. As all of you know, things continue to change daily. This COVID-19 epidemic we find ourselves in is a continual process for us all. So we're refining things as we have information. I do want to thank everyone in this community. I want to thank all of our partners on the phone, everyone out there who's volunteering, our medical professionals, our responders. The list goes on and on and on, and all the people on this call and all of their staff as well. So to kick it off today, I want to turn this over to our Health and Human Services Director, Suzanne Wright, to be able to give us a quick update on what our Public Health Department is doing in their conversations with the North Carolina Department of Health and Human Services and the medical community. So Ms. Wright, I'm going to turn it over to you, please.
Thank you, Mr. Eller. I want to start by pointing out how everyone can access daily COVID-19 updates from Davie County Health and Human Services. So please make sure to share this information with others, because right now we're hitting about half of the county's population, and we want to make sure everybody gets this information. So for those with Facebook, please go to facebook.com/DavieHD. The second option is daviecountync.gov. You can scroll to the lower portion of the page and look for the coronavirus updates button. This button will directly link you to the health department's webpage, where all COVID-19 information is housed right now. And finally, you can subscribe to receive these alerts, receive text alerts on your phone by going to daviecountync.gov, clicking on the Notify Me section, and then enter your contact information and select the phone or email icon next to the health department. I also want to explain information presented in the updates that we share. First, when you see the number of laboratory confirmed cases noted in daily updates, please know that lab confirmed means someone actually met criteria for testing and tested positive for COVID-19. Right now, many providers are only testing individuals with severe COVID-19 symptoms or those being admitted to hospitals. As you've heard or seen in the news, many individuals with COVID-19 symptoms are being asked to stay at home and contact medical providers by phone unless symptoms rise to the level of a medical emergency. This is for their protection and the protection of others. And this also means that many sick individuals are not being tested. Only those with laboratory confirmed cases are being monitored by public health staff. So just want to let you know that just those testing positive are followed up with by public health nurses. Also remember that there have been lab confirmed cases of COVID-19 in Davie County where the individual showed no symptoms at all. And some of you are probably wondering how they got tested if they were showing no symptoms. And they were only tested because of very close contact with a known positive case. There have also been individuals tested that receive a negative lab result initially and then test positive at a later date. This typically occurs if symptoms persist and another test is administered. Many people with COVID-19 symptoms are never tested. Many have been seen by medical providers and asked to follow the same guidance as those testing positive for COVID-19. People with COVID-19 are now known to be contagious before they ever show symptoms, and nobody thought that before. So knowing everything just mentioned, the true scope of COVID-19 in this community is far greater than reported lab confirmed cases show. So I don't want everybody to get caught up on the 20 cases or the number of confirmed cases, because that's just a number and it doesn't show the true extent of COVID-19 in Davie County. I will tell you that after speaking with many patients in the community, we've identified a few trends with these cases. Most have been tied to either church functions, mass gatherings, or travel-related cases, or close contact with a family member. And we've also had several with community spread. And I know everybody keeps wanting to know what community spread means, and that's when we don't know how someone contracted it. They did not have contact with someone who was tested positive for COVID-19, and they have not traveled to a highly impacted area. So I know we get a lot of questions about where people with COVID-19 have been in our community. Short answer to that is everywhere. When you are outside of your home, anywhere that you go, other people go too. So two main things to remember is public health staff monitor laboratory confirmed cases, so we know exactly where individuals with positive cases are. They're isolated at home when they're sick and can't come out until they're recovered. But not everyone with COVID-19 has symptoms, and not everyone with COVID-19 symptoms get tested, which means that there's no way for us to track where these individuals have been. So we're just going to keep our message consistent. It's the same thing you've heard over and over. Stay home if you can. Stay 6 feet away from others if you have to go out. Wash your hands after touching anything that doesn't belong to you. Clean and disinfect surfaces frequently. Wear a face covering when out in public, and if 6 feet of separation from others can't be achieved. And right now, act as if everyone is contagious. Thank you.
Thank you, Ms. Wright. I appreciate all you and your staff are doing for everyone at this time. It's very important to continue to hear from y'all and get your daily updates, so we know how busy everyone in public health has been. So thank you so much for all your help. We'll now transition to Sheriff Hartman. Sheriff, would you like to give us an update on what's happening in your area?
Yes, sir. Good afternoon, everyone. The Sheriff's Office is still fully staffed. We're still answering calls. I'd like to remind everybody out there that if we answer a call, not to tell us you have coronavirus in an attempt to delay or obstruct how we're handling a call. That is a crime, and we will charge you with it. We also are still handling all of our assigned duties. We're processing gun permits. We have only one public access point to the Sheriff's Office at this time. That's in the building directly behind the courthouse. You'll see above the building, it says Civil Division on it. So if you need to come and see us for a hand-to-hand transaction, that's the only location that you can do that. We still are suspending visitations at the jail right now. I know there's some information out there about detained persons not getting medical assistance, but we have medical staff on scene 12 hours a day, 7 days a week to monitor them and take care of folks. Everybody going in and out of the jail is being tested or screened, excuse me, for the warning signs for coronavirus. I also like to address the question we get a lot, especially with Easter coming up. The governor's orders allow drive-in church services as long as you stay in your car. Having said that, I'd like to remind you just something that Suzanne touched on from the health department about be careful if you're taking communion or passing things from hand to hand, person to person, in and out of the cars, that those surfaces have been cleaned, wiped, sanitized very well. If you need the sheriff's office, we're here. Give us a call, and thank you for your time today.
Sheriff Hartman, we appreciate all that you and your deputies are doing, and just you working with law enforcement agencies to get us through. So thank you, sir. We'll now turn over our conversation to Mr. Brian Bird, who's with our Emergency Services Department.
Thank you, Mr. Eller. Good afternoon, sir. I'm just going to start and try to catch us up before we start at and where we're at today. Davie County initiated the county state of emergency declaration on the 16th of March. Our towns of Montsville, Bermuda Run, and Coolmey, they followed suit and joined in that declaration. During the times that we're under a state of emergency, emergency management shares information with all of our county and our municipal partners. We also stay in close contact with our volunteer fire departments and our rescue squad and our law enforcement folks. The health emergency that we're experiencing has caused emergency services to alter some of our daily operations. We're working with all departments. We've offered services. We've altered our call responses to try and reduce exposures for all the responders that respond to possible COVID-19 patients. Communications actively utilizes a health screening process for 911 calls, and this makes sure that only EMS units are being dispatched to our medical calls. And we're holding our first responders in reserve unless it's absolutely necessary that those guys are exposed. We've placed our EMS supervisor on a quick response vehicle, and we're using that person as an additional medic for the medical calls. When you see our EMTs and paramedics on calls now, you'll see that they'll have a little bit of a different process sometimes. As they arrive, they'll be following additional procedures that protects both themselves and it protects our patients. On all our calls, we're going to have our providers using a mask and gloves. Some of the emergencies that we'll go to will require that they don an N95 mask. They'll have a gown on, they'll have gloves, they'll have eye protection. And I just ask that you be patient with them as they don this protective equipment prior to being in contact with patients, because it helps both the patient and the crews. Our EMS medical director holds routine conference calls with our crews every week. This is to keep us up to date on our latest medical advice, on best practice, and on situations that maybe are popping up around the country that we haven't seen yet. This helps us to be up to date with our provider safety and with our patient care. If you've been following news reports, you can see that a lot of places are having a hard time getting personal protective equipment for providers. We've also had a little bit of difficulty in purchasing that. And we've been working the phones and sending folks out and scavenging the countryside, and that's how we've been getting the equipment together that we need to make sure we can do our job. We buy supplies where we can find them. Also, we have partners through North Carolina Emergency Management, and they help us in receiving supplies by sending some of the reserve supplies to us through the Triad Healthcare Preparedness Coalition warehouse that we have right here in Montsville. This is a state resource for surge for us. As these warehouses have been depleted over the last few weeks, now we're starting to see National Guard troops come in, and they're delivering some of the supplies from the Strategic National Stockpile. We actually got one of those deliveries this week, which was a great help. Since people have been watching the news and knowing that masks and gowns and things like that are hard to come by, a lot of our local businesses and our citizens, they've helped us out by donating N95 masks from their own supplies. We had a construction company that brought a large case of those N95s to us that they used to protect their workers from dust. They saw that it was a need for emergency services to have that, so they brought it by and donated it to us. There's a lot of folks out here that are sewing and donating masks also, and I'm talking about both folks from private residences that are doing that, but we also have some of our local businesses who have retooled and changed their process, and they're making masks and sending out to hospitals and emergency services and health departments and things like that for us. We've also had even dental offices and clinics and auto supply partners have been getting equipment to us, so everything that's sent to us is greatly appreciated. The Davie County Emergency Operations Center opened when the state of emergency was declared. The EOC is part of the local emergency management. We provide resource management for our local stakeholders. Personnel from multiple departments come and help us in the EOC. They help us to answer questions, talk to people about stay-at-home orders, manage supplies, make sure those type of things gets to our partners so that everybody can get the job done. DOC staff also is tasked with having calls to North Carolina Emergency Management and FEMA, and we make resource requests, and we try to help identify gaps in services when we see those. DOC staff participates in state calls and national calls each week. And as health-related calls come into the EOC, we forward those over to the hotline at the county health department to help folks know what to do and what to look for. We review our contingency plans each day. We pretty frequently have to alter those plans because the information keeps changing. And we do this so we can help the county carry on and services won't be interrupted. One of the most frequent calls that we've got during the last week is from citizens and businesses. They've been asking about reentry passes and travel permits. These are not required. There are no curfews in place in Davie County. There's no curfews in any of our towns. So even though we're under a state of emergency and a stay-at-home order, a pass to travel around is not required. And as all these emergency things are going on and the new processes are in place, in the background, our staff still has a responsibility of making sure that operations are not being interrupted. We've got our training taking place, we're paying our bills, we're cleaning our equipment, taking care of things. And so as we move forward, we'll just try to continue to look for ways to improve. We'll adapt as the situation changes. And if we have questions that come in, we'll try to answer those for you also. Thank you, Mr. Eller.
Thank you, Mr. Byrd. This is a great example of the community pulling together regarding the PPE supply issue we've seen across the whole country, and just people coming together to sew masks and donate what they have. It's just been really good to see the community come together. So, Mr. Byrd, we appreciate you and all your staff for all that everyone's doing. So now we'll transition over to our 911 Communications Director, Mr. Rodney Pierce.
Thank you, Mr. Eller. Just to highlight on some things, communications is kind of the central hub to the county. We assist Sheriff's Office and emergency services in general, along with utilities and the health department. We're basically asking, do not call 911 for generalized questions. Please utilize the 911 lines for true emergency situations. For specific questions regarding to COVID-19 questions, contact the health department helpline. I believe that number is displayed up there at 336-753-6750, or the North Carolina state helplines that have been set up for this particular incident. Once again, please call if you do have an emergency, but generalized questions, we're asking you not to call. Just some generalized information of what our 911 Communications Center is taking place, just as Mr. Byrd has mentioned. On 911 medical calls and law enforcement calls when applicable for them. To ensure responder safeties, we are asking screening questions. They were basically entail of, do you or the patient have a fever, and call for any other respiratory illness. If the answer is yes or negative, responders will be passed along that information just for safety measures for them. We do have contingencies in place to ensure adequate staffing. We're in constant communications with other state 911 centers or other 911 centers throughout the state. A lot of us are implementing the same procedures and policies. There's a good network in store for state information being shared out between the centers. At present, we're at capacity on our staffing. We do have limited access to our facility to essential entry only. Right now, our staffing is strong and standing by to assist. That's basically the update we've got from 911 Communications. I'm going to pass it along, and thank you for all your help.
Thank you, Mr. Pierce, for all that you and your telecommunicators do. We'll transition now to Public Utilities Director Johnny Lambert for Davie County Utilities.
Thank you, Mr. Eller. So here at Davie County Public Utilities, we're continuing operations with a heightened awareness of the good social distancing and a strong focus on the safety measures that are being put in place by Suzanne and the health staff. So we believe it's important to maintain all of the operations for the utility at this time. So per the governor's order 124 that was recently released as of March 31st, 2020, The utility must suspend disconnection of any residential accounts for non-payment. This only applies if there's a delinquent account as of March 31st. So anything before March 31st, it doesn't fall underneath this executive order. And if any delinquencies are incurred between after March 31st and June 1st at this time. We've suspended all the late penalties. We will not impose any late penalties for late or untimely payments as long as we're underneath the state of emergency and the governor's executive order. And payment plans, we know this is tough times for everybody, so the order states that we must offer residential customers one or more reasonable payment options. So they can call us here at the office, 336-753-6090, and we'll have staff help them move forward and set up some payment options for them. We, like most of the county departments, are not allowing public into the buildings, but we are handling everything, email, phone conversations. So we're here to provide that service whenever they need it. So all they've got to do is call our office at 336-753-6090. Thank you, Mr. Eller.
Thank you, Mr. Lambert. We know public utilities are very important during this time for everyone to be as sanitary as they can to get through this epidemic. So we appreciate all that you and your staff do, not only to treat the water that we all are using, but also the work that they're doing out in the field to make sure that our pipes continue to get the service they need. So thank you to you and your staff. Now we'll transition, last but not least, to our superintendent, Mr. Jeff Wallace, to give us an update about the great work that our Davie County school staff are doing to serve our families and parents and children during this time of need. Mr. Wallace.
Thank you, Mr. Eller. Good afternoon, everyone. I want to say thank you to everyone on this call, and I want our citizens and community to know that most everyone on this call I talk to routinely, and that we are working together. Calls are being answered, texts are being responded to promptly in a timely manner. And there is truly a unified effort taking place to ensure the safety for Davie County citizens, and particularly in my area are the students and the staff that we work with daily. My update today will involve the directive, the closure of schools by the Governor Cooper that was ordered on Saturday, March the 14th in Executive Order 117. In that order, the governor listed three primary directives for schools and for school superintendents, and those are childcare, nutrition, and remote learning. Now, again, this executive order was issued in the late afternoon on Saturday, March the 14th. With that being said, our childcare was open on Monday morning for staff and paying children, and we were able to extend that childcare service for emergency workers on Thursday of that same week. Since the initial executive order on 117, our child care guidelines have changed, but we have made adjustments, we've adapted, and we are still providing necessary child care for some staff and for our emergency care workers. And again, directly involved here, I spoke with Mr. Eller and Suzanne Wright to make sure that we're doing this in an effective manner. And one thing that I will say, even when we get executive orders, community, I want you to know that there are very strict guidelines around and laws and statutes around what we do regarding spending and funding and childcare and education. But I have kind of adopted a term, as I've spoken with all of our staff in our district, that we're operating with plenty of grace and the guidelines. So we're trying to stretch those guidelines and get as much flexibility as we can to meet the needs, particularly around these three directives. The other directive was around nutrition, school nutrition, and basically it was to make every effort that we could to feed children. So again, the order came out from the governor on Saturday. On Tuesday, 3 days later, our child nutrition director, Mr. George Selecki, and his team rolled out their summer feeding plan. Obviously, it was adapted somewhat, but they began to roll out and feed children on Tuesday. Wonderful and amazing turnaround to be able to make that happen. On Tuesday that I mentioned, the school nutrition staff fed a little less than 1,000 children. By 2 weeks later, we had already fed nearly 50,000 meals. Not 50,000 children, but 50,000 meals. That means we're providing a packaged lunch and breakfast for children. The school nutrition plan, George and his staff continue to open up additional sites. What we would do is take a look at the needs in our community, geographically plot out areas that we would move toward, and we are now reaching into over 30 different sites to meet the needs of children regarding school nutrition. We anticipate serving nearly 80,000 meals a month. Again, that is a phenomenal and amazing challenge, but I will tell you our staff is meeting that need. There are, again, I mentioned guidelines. We must commend the North Carolina Department of Public Instruction, the General Assembly, and the State Board of Education for allowing us a tremendous amount of flexibility. At your school board, your elected school board, 7 members enacted policy to give the superintendent and his staff emergency priority in making decisions to be much more flexible. And I commend them for doing that. And we have worked together to make sure, again, providing childcare and nutrition. The third directive from the governor was to spend 2 weeks, because in the initial Order 117 closed schools for 2 weeks through from starting on the 16th through March 30. The third directive was to put together a remote learning plan. Your school district is not a one-to-one district, and that was in part intentional. We have plenty of technology, but the point in referencing that is that we did not have a remote learning plan. Your leadership team worked hard and built a remote learning plan from the ground up. That involved teachers, some students, a few parents, but instructional coaches, staff, principals, everyone built a plan that was ready to roll out in 2 weeks. During that time, we also conducted a survey with our parents and community about needs for devices. And thus far, we have distributed a little over 1,000 devices to families in need. We have got a help desk set up and a plan to manage this remote learning until the school closure is over, which at this time is scheduled to be through May 15th. And we are very hopeful that we will be back in school on May 18th. But obviously the safety of our students and our staff and families are most important, but we will get that directive from the governor. And I want to again go back and just commend our staff and everyone that's involved in making sure that these 3 directives took place or were enacted. I would like to reference you all to the Davie County Schools website for ongoing updates and information. We send out what we call a school messenger or messages that reaches nearly 10,000 people. We send out routinely, more often now due to the situation we're faced with. And my closing comments again would just say thank you to everyone here and what you're doing. And as your school superintendent, I'm humbled and I'm honored to serve with this group today. I'm also honored and humbled to serve you. And we will continue to stay focused on our purpose, and that's safety and meeting the learning needs of your children, of our children. Thank you, Mr. Eller.
Thank you, Mr. Wallace, for what you and your staff have done in a very short amount of time to serve our children and families in Davie County. And again, I want to thank this team. Before we close today for this first episode, any other comments from anyone that we feel like needs to be addressed before we adjourn today? Okay, if not, we would like to encourage those listening and our citizens to be able to get information to us weekly regarding questions that you have or things that you may want more information about. Obviously, in a short amount of time on these kind of weekly updates, we won't be able to address every single thing, but we will be looking for themes to address, and we want to be responsive to the needs of our citizens. And we'll invite future topics and speakers to join us and be part of this call. I'd like to thank everyone on the call today. You're making a real difference in Davie County, and we will continue this conversation during our next episode. So our prayers go out to all the families that have been impacted by this COVID-19, and our thanks on behalf of the Board of Commissioners to everyone that's involved in this response and continuing to provide services to our community and our Davie County citizens. So with that, we'll see you on our next episode. Thank you.